city's interim safe injection sites. Now, Toronto Board of Health will be meeting Monday night, and a number of items on the agenda are related to overdoses in this city. Now, the chair of Toronto's drug strategy panel, Councillor Cressy, says that the city is in crisis. It has been for years, and he's hoping to introduce a number of measures to deal with this growing issue.
We're looking to expand the number of supervised injection services and sites we have in the city. I have a motion coming forward on that. Another critical piece that we're doing is calling on the province to declare an emergency. When an emergency is declared, that means funds can flow quicker and more proactively to those who need it. And if this is an emergency as it is, we need the province to respond as such. So there's no silver bullet to the overdose crisis. There are a number of different issues at play here. And that's why we need a comprehensive response and a city coordinator, a designated lead to oversee that work. And so we're calling for the medical officer of health to be designated the city's overdose response coordinator and to have the authority to direct departments as needed so that they can also take action.
And Cressy is also calling for Naloxone, the drug that reverses the effects of an overdose, to be more readily available in first aid kits in public spaces, and for Toronto City councillors to be trained how to use them. We spoke with one frontline harm reduction worker who says he's welcoming the motions being brought to Toronto's Board of Health, but he thinks more should be done by upper levels of government.
What needs to be done really needs to be happening at a provincial and a federal level to really tackle the problem. But I applaud what Joe Cressy is doing to try to do what can be done at a municipal level.
Of the things that he's brought forward, which do you think is the most vital?
Asking the province for an emergency response. We saw them have an emergency response with things like SARS and H1N1 that were really, really effective at crisis management and infection control. And we have an epidemic with, many more lives lost, but absolutely no emergency response or crisis response from the province. We've got a premier that hasn't even talked about the problem, and we've requested an emergency type response multiple times. It's partly about money. A lot of it is about removing barriers, even just how do we communicate through different levels and layers, and from information from the street getting up to people making decisions. There is no clear communication channels yet. We even have a hard time figuring out how many people are dying of overdoses, how many overdoses are happening.
Councillor Cressy agrees on that last point, and that's why one of his motions is calling for real-time data collection about where overdoses are happening, and that could help determine where injection sites are needed. Now, last month, Ontario's Health Minister Eric Hoskins committed to investing $222 million over 3 years towards Ontario's strategy to prevent opioid addiction and overdose. Now, one thing that many in the harm reduction community are calling for, including Councillor Cressy and the chair of Toronto Board of Health, Joe Mihevc, is the decriminalization of hard drugs like heroin. They say it should be treated as a public health issue as opposed to a criminal one. Janelle Amasa, City News.